All right, I am Ginille, a cosmetic nurse practitioner. I've been injecting Botox fillers since 2013. Let me know what questions you have. I am just finishing up charting for the day. I'm only going to be on here for about 10 minutes, but I'm going to try to jump on later. So if you have anything, if you want to jump in and do a quick consult, we can do that. Today I saw patients for lower face, like some chin and jawline enhancement. And I saw patients for cheeks, temples. With filler, I saw patients for our weight loss program. In Vegas, our patients were doing facial balancing and some skin treatments. And yeah, so we're just seeing patients. We have nurses in 3 offices, nurse practitioners. So I'm in Torrance today. We also have providers in our Mar Vista clinic and in Las Vegas. So I see patients in all of them. My team members, we travel to different clinics. I can talk to you about any of the treatments that we offer. I can also talk to you about treatments that I have done. This is me when I was 28 years old and I had never done any treatments previously. And this is me now. I am tired today and I'm about to go home and get my children. And if you guys were on my live last night, you heard them all interrupt and I had to get off live. So I was like, let me talk before I go and see these babies. But let me know questions you have. I know a lot of people had questions on Botox and all the different areas of the face you can treat. We talked about frown lines, horizontal forehead lines, around the eyes, bunny lines, gummy smile, lip flip, chin dimpling, for the downturn part of the mouth, your neck bands, and then into your masseters and temporalis muscles for TMJ symptoms. Those are very common areas. I made a video that was talking about 165 units of Botox in the face and what it looks like. And some people are like, wow, I just didn't even know that you could do Botox in all of those areas. I have done Botox in all of those areas. Our patients do them, and everybody, I think people were like, oh, do I have to do all of those units? Do I have to do all those areas? And you totally don't. It really depends on your goals, your face, what your concerns are. Everyone's dose is a little bit different. A lot of people that do lower than that. I have patients that do more than that. I have patients that have done 400 units because we're doing their trap muscles and their calves for slimming. So everyone is different. The biggest thing is that you're consulting and going through what your goals are with your provider, making sure you are finding a provider who listens to you, is going to be safe, is licensed. That is basic. I can show you lots of patient before and after photos. I'm going to stand up real quick in the office. I'll show you just some of our patient before and afters. I can show you people that look like you, and that you like the outcomes, and that they, you know, if you feel like, hey, I want something more dramatic than this, then you would find a provider that can give you something more dramatic. What we focus on in our office is natural looking results. Does non-surgical rhinoplasty give instant results? Yes. And let me see if I have some over here. Oh, I have to pull them up on iPad to show. But yes, you can see instant results with, I'm just looking on our wall, with your nose filler. So we can use nose filler to camouflage the bump of the nose, lift the tip, to make it look more like contoured from the front, like build up a bridge. We can change the shape of the nostrils for the patient as well. We do a lot of non-surgical noses on all skin types, all skin tones. When we do it in 2 sessions. Do some, let it settle, reassess at 6 to 8 weeks where we can come back and do more if we want. We just don't want it overdone. And that initial session is like laying the foundation. So we can build on that if we want 6 to 8 weeks later. I tell patients it lasts 1.5 to 2 years. I have a lot of patients that come back to me 2 years later and they're like, Ginille, you said to come back and like check in, and they're like, it looks perfect. I don't know, should I do anything? And I'm like, no, if it looks perfect, like we don't want to add unnecessarily. Keep it as it is, and we can, you know, if you see it fading, we can add. But people like it because they don't have to do surgery. It takes just a few minutes to do. They can see the results right then and there. There's no downtime. You might have a little bit of swelling, possible bruising. The swelling resolves within a couple of weeks, but it's not like surgical swelling where it's like for months and you don't really know the full effect. It's not like that. Sorry, I am finishing some notes. And okay, let me make sure I answer. How long does it last? 1.5 to 2 years, pretty easily. A lot of people get longer out of it. And even when they're coming back for their maintenance, sometimes we don't even do it. And if we end up doing it, it's like it doesn't look like it's all the way gone. It's not like, oh shoot, that bump you had, it's all the way gone. Let me see if I have some noses. I had some last night when I was going through patient photos, but I have since, there we go. Here's one. I've been taking patient pictures today. So she wanted to like camouflage that bump on her nose. You can see there. And then she wanted the tip to look like lifted. So we did that one. Here's a nose I did this over a couple sessions. She wanted to camouflage the bump. She wanted the tip to be upright. She wanted it to be straight. So we can make, some people want to keep a little bit of their bump. So we don't have to make it all the way straight. Some people want their tip turned up. Some people just want it straight. But yeah, she's like, my family's not going to let me do a nose job. And yeah, she did that and she was so cute and she loves it. Let me see some other noses. I'm just trying to scroll through photos I had set up for the live last night. Here's another nose. This one is subtle. You know, she had this tiny bump and she felt like the tip was more angled downward. So we lifted the tip, we camouflaged the bump. So those are just some of them. She wanted her nose bump camouflage and then she wanted it turned upright. So some people want that, like I want it to be like a Tinkerbell tip. So you can do different things with noses, and I still have these photos set up so I can talk through patient before and afters as well. Okay, let me see if I'm missing anything. How much does it cost? I do it in $2,000 and it covers 2 sessions. So do it, come back 6 to 8 weeks later, fine tune, add more if we want. 1.5 to 2 years, but again, most people get longer out of it. There's no downtime with it, which is lovely. And you can see the results instantly. And we can like, you know, again, if you want it upright, if you want it straight, if you want to make your nostrils. I've had patient requests that I'm like, oh, is anybody looking at your nostrils? But I've had that multiple times where people are like, I don't want it triangle. I want it like rounded. So I'm like, okay. And we can do that with filler. I will flip through some other, oh, here's another one from the front. From the front, people are like, what's it going to look like? It's not going to pinch your nose in and make it super tight, but it can make it look more contoured and defined along the bridge. So patients will tell me like, oh, it looks like I use my contour, or I don't have to contour my nose as much. She wanted, when she smiled, she felt like her nose turned downwards and she wanted it to be scooped upwards. So yeah, these are like immediately before and after. She doesn't have to go through crazy surgery. She doesn't have to, I've had patients that have done rhinoplasty, but they tell me like, I don't know the full results for a year because of swelling. And I've had multiple patients that have had multiple rhinoplasties, and it's just kind of like, it's a lot to be going through and having to do another surgery. So, but there's different options. I highly encourage people. I'm like, don't rush any of the options. Like really do your consults and see what you think is right for you. Some people are like, I don't want to like have to come back and do this in 1.5 to 2 years. I just want surgery. And they're okay, you know. Some people are not candidates for filler. If their nose is really wide and they want it pinched in, that's going to be more of a surgical thing. I will flip through some more patient before and after photos here. These are just people that I have seen and my team and I have seen over the years. We treat all skin types, all skin tones. We really focus on getting natural looking results. We focus on your face and keeping it look like you and fresh, never overdone. I want it to just look like if you're walking down the street, no one will know you've done anything, but you just look fresh. So if you only look at, what is that, the right side or left? If you only look at the side, off to work, I look ridiculous. If you only look at the after, you can see it. You wouldn't think that they had done anything. You would just think, hey, she was born that way, and that's the goal. She did some chin augmentation. Sujia looks so beautiful. We have done cheeks, smile lines, lips, corners of the mouth, her chin, her jawline, and just looks so fresh, so beautiful. Again, we treat all skin types, all skin tones. Have I gotten, oh yeah, we do men. I just don't have one pulled up here, but yeah, I've gotten men for rhinoplasty. I have done everybody, every color, every skin, every person, people, everything. All the patients, all ages, all backgrounds. And yes, sometimes men want their nose wider. So it just depends. Like the biggest thing is that we talk about what your goals are, because each face is different and people have different goals. And not everybody wants a completely straight nose. Not everybody wants a thin nose. So everyone's different. So this is why we will go through your questions. We'll go through your goals. This is why I try to show different faces. And these are just some of the patients that I have, but that we have in our office that have consented and allowed us to show their before and afters. I have probably thousands of patients that have consented for us to use them. It takes time to just put these together and like click through them. But people have done different treatments. Can you make to, where is she saying? Can you go to Rhode Island? Oh, that's cool. I have not been there. So yeah, these are just some of the patients that I had set up from last night when we talked, and that's me. We were doing some more patients today. I was looking at patient before and afters. The patients, again, they just look fresh. Like you wouldn't know. Like that's the goal. We want it to look like you. Okay. And we see patients every time I'm in clinic, guys. I see patients from all over. Like people fly in outside of state, outside of country. I've seen people from all over, and I'm very grateful. And I connect with them here. We do virtual consults before you can come in, so we can talk through your questions, your goals, give you tips on what to expect, how to prep for treatments, so they are ready. I saw a patient today, and she's in LA. I wasn't even like going to see patients today because I have to do admin stuff and she was like begging the team. She's like, if she's in Vegas, I'll drive to Vegas. I just need to see her today. And she came, we did her lower face, and it was great. But then I saw a bunch more patients. Okay, let me go through thoughts on peptides D. I saw your thing. You know what? I have not studied it enough, and it's kind of newish to the market. I am slow to bring on newish things. It might end up being great. I like to really study stuff before I bring it on. I just want to make sure safety, it's fine. We use GLP-1s in our office. We do Zepbound for patients, medically supervised. We're seeing patients on a weekly basis in our program. But the others I've thought about, but I'm always trying to be like, what's going on? Let the dust settle. I know everybody gets excited when new stuff comes on. Let the dust settle, and then let me see how people are doing with it before I say, yes, I'm going to stand behind this and totally do it. So slow to bring things on. Anything that I bring into the office, guys, it is tried and true, and like I've tried it on all skin types, all skin tones, on myself, on our team, on our family, on our patients. Like I believe in it. I would not be on here trying to like tell you guys to do something I didn't fully stand behind. So peptides, PDGF, some skin tightening devices, guys, I'm like, just slow down. Some of these skin tightening devices, several I've worked with over the years and haven't seen like the greatest results with them, and so I'm just slow. Those are my biggest things. Let me make sure I didn't miss anything. Okay. I don't think I missed any. I'm probably going to jump off and then try to come on tonight if my children don't bother me. But D, if you're really thinking about it, because I've heard great things about it, just find somebody like they specialize in that. They specialize in it. Like, how long you've been doing it. Tell me what's the worst possible outcome. Tell me all the benefits. Like, do your thorough research. Don't just, people hype stuff up. You don't want to just believe the hype when it comes to any of this. Even for me with all this stuff, guys, this is why I try to show receipts. And this is why I try to show like patients and before and afters and different skin types and tones. And I've been doing this since 2013. This is all I focus on. Is aesthetics, and like this is what I have built my practices on. And I try, read reviews, look at patients. They're making their own videos when they're here, not just me. But like, you want to go to somebody who is specialized in whatever treatment you're considering. Do not rush treatments, guys. Don't do it. Best laser for brown skin people, depends on what your skin concerns are, but Aerolase is tried and true. We love it in our office for fine lines, pores, dark spots, acne, hair removal, DPN, little like moles, pigmentation. We also do SkinPen microneedling. We do bio-repeal chemical peel and hydrofacial in our office. Everything then that we do, safe for all skin types, all skin tones. No downtime with the laser, with the SkinPen. SkinPen has a little bit of downtime, but with the bio-repeal and the hydrofacial, so no downtime. The microneedling does have a little bit of downtime where you're going to be slightly red, rosy, dry, flaky. Let me just make sure if there's any others. So we do thorough like skin consults when you come in. We're talking about treatments that you're using. We're talking about your routine, what's your sun like, all these different things before we decide to give you a full recommendation. At the very least, guys, use your sunscreen. You can use a retinoid in the night, but thank you so much, unforgettable. At the very least, use your sunscreen and reapply it. Yes, even if you have black and brown skin, if you get sun damage on black and brown skin, it's harder to treat. We can't just burn our skin off and have it heal in a week like white girl can. So it's something you want to be mindful of, like avoiding the sun, and there's aging that happens with it and wrinkling. Okay. Hi Sienna, I love you so much. How are you? I go on. Sienna's my friend, guys, and she has a really fun lives. Sienna, I don't even know what's happening here. These are I'm just on here talking, but I love you and I love going to your thing. It's like going to a party every time. So you guys go watch her. I'm going to jump off. If you have questions, call us, text us, the number in my bio. I see all the texts that go through. You can DM, but sometimes I get lost if I'm like seeing patients, so I don't want to miss your message. And then we can set up a virtual call and go through anything. And also you can always jump on here and we can talk through your questions. My husband is like, girl, get outside so we can go. Okay, I'll talk to you guys soon. I hope you have a great day. Love you, Sienna. God bless you guys. Bye.